Hello friends, welcome back. In this video lesson, we shall be looking at a case from the files of Dr. Walter Gluck, who is from Vienna, Austria. This is just to emphasize the fact that homeopathy can be very well used in serious cases, especially in intensive care and emergency medicine. This case is taken from the book Homeopathy in Intensive Care and Emergency Medicine by Drs. Frass and Bundner. This is the case of a 82-year-old female patient. She's just had a myocardial infarction and she is being monitored 4 days after the incident. Her blood pressure is falling day by day and she's been put on an infusion of dopamine and Wobutrex. But she has developed hypotension and cardiogenic shock. So her condition is basically deteriorating and there is little hope for her. Here are the symptoms and observations by the doctor. The patient has an ashen face. She's lost all color. The pulse cannot be found. There is tachypnea, cold skin, and her ECG shows atrial fibrillation and tachycardia. Also, there is an arrhythmic QRS complex on the ECG. She has been diagnosed with cardiogenic shock following myocardial infarction. The conventional treatment is that she is receiving oxygen via mask and the infusion mentioned earlier. She is being given a medication of dobutamine, nitroglycerin and diuretics. But as mentioned earlier, she is not making any progress and her blood pressure is falling day by day. Here are the observations that are recorded by the doctor. She recovers consciousness at irregular intervals, intermittently. And when she does, she becomes restless and is moaning. She does not want to eat or drink. And even though the room is very cold, she demands an electric fan. And she in fact is in a condition where she directs that the fan be directed towards her so that the air can blow directly on her. The draft of air makes her feel better. Let us see that in addition to the medication that she is getting and on which she is showing no improvement, how we can go about making a homeopathic analysis of the case and finding a remedy which suits her. We observe that she requires fanning and the draft of air makes her feel better. She is worse when she is covered and she demands that her covering be removed. Warmth aggravates and she is unconscious because she keeps coming in and out of consciousness after some time. This particular chart shows a typical analysis from a homeopathic software. We have taken all these symptoms and mind you, these symptoms are what we call as generalities. They have got nothing to do with the pathology and they have got nothing to do with the ailment or her principal symptoms. What we are concerned is trying to individualize the case for that person. The only thing that relates to her state is that symptom which describes her state as unconsciousness or coma. As you can see, the remedy with the highest score and the one that is covering all the 6 symptoms is Cardiogenic. There are 5 more remedies, but at the moment we are not analyzing those, and as you can see, the score is much lower. Cardiogenic or carbo-veg as we call it is also known as a corpse reviver. It comes in handy when a person is in a total state of collapse. Some of the other important symptoms which will be shown by the patient who requires this medication are that they are covered with cold sweat as in a collapse. Their breath is cold, their face is cold, and they also feel a cold tongue. In fact, they look like a cadaver, like a dead body. They are not only unconscious, but they are looking absolutely, as described, ashen-faced. And in all these conditions, whenever they recover consciousness, they desire to be fanned. They want a draft of air flowing over them. And in this particular case, even though the room was quite cold, still this lady required fan to be put on and directed towards her. Very characteristics of carbo vegetabilis. Now the homeopathic treatment that was given to her was a single dose of carbo veg in a potency of 30C. Just 5 globules on her tongue. Shortly after that, she asked the fan to be put off. She fell asleep and slept throughout the night comfortably without any disturbance. Next morning, she woke up as if nothing had happened. What a remarkable recovery with just 1 dose of carbo veg. Indeed, truly it is a corpse reviver. And she asked for breakfast, something she had been refusing for the last 4 days. And she was alert, but her blood pressure was still low. She was kept under observation and with the same treatment for a week, and then after that she was discharged and allowed to go home. What is to be noted is the remedy action. This particular presentation also points to the fact that homeopathic remedies can act very quickly. Not only can we use homeopathy in intensive care and emergency medicine, but we can also expect a very fast action of the remedy. And in this particular case, the temperature behavior and her sleep pattern, they are just the appropriate actions of that remedy. Also, the recovery can be attributed to a concomitant homeopathic treatment. We can't say that it was only homeopathy that helped. It's a whole gamut of other care. The caregivers, the hospital environment, the amount of attention paid by the doctors. There are so many other things. But as we can see that for the first 4 days, she was not responding to the normal allopathic treatment at all. So this is one area I would like to emphasize, that in integrative medicine, we want to use every possible way to bring relief and comfort to the patient. The best part is that this case had a very happy ending. The patient lived for many years following this acute incident. So friends, that brings us to the end of this presentation. I hope I have been able to convey the point that homeopathic treatment and homeopathic remedies are very quick acting and they are extremely suited for intensive care and emergency medicine. In other presentations also we shall be seeing how they can help in acute conditions. Besides, of course, the main area where homeopathic remedies are very popular with the people are chronic ailments. So with that, thank you very much and we'll meet once again in another lesson. Until then, bye-bye.